Yes, sir. First, we have Josna Thomas, Dr. Rosa Maria Murillo, Dr. Liz Schoenfeld, Jeffrey Bowen, Mary McGowan.
Well, thank you all for being here, and we'll start right here. Thank you.
Thank you. My name is Jolsona Thomas, and I'm speaking on behalf of One Voice Central Texas. I want to, in particular, highlight the second document in the backup for item number 7, the 2025 audit, and specifically to refer you to page 10 and the table that is found there. I will now yield the rest of my time to the chair, Dr. Rosa Maria Murillo.
Thank you, Jolsona. I'm Dr. Murillo. I serve as the chair of the One Voice Central Texas. I am also the CEO for El Buen Samaritano. But before coming to El Buen Samaritano, I serve in state and local government, including Austin Public Health. So I bring that to my testimony with you today, having the privilege to sit on both sides. I want to start by saying that I absolutely support the audit. If an independent review fails to identify opportunities for improvement, it has not done its job. Independent oversight strengthens government and public trust. My concern is not the audit. My concern is what happens with the audit. Good government depends not only on accurate findings, but on accurate interpretation of those findings. Over the past week, many Austinites have understandably come away with the interpretation that nonprofit organizations broadly failed to deliver services and failed to be accountable. That is a powerful public interpretation, but it's not the conclusion that this review was designed to reach. During our meeting with the auditor's office, we were advised that this review was not designed to evaluate Austin's nonprofit sector as a whole and was not intended to determine whether social services funding should be increased or decreased. Last week, the city manager reminded the council that we should not manage by newspaper headlines, and I absolutely agree. Headlines simplify, and specifically the headlines that were intended to damage the very partner that the city depends on to serve tens and thousands of residents in Austin, Texas. There is one additional point that I believe is important. Today, there are 4 separate government processes occurring at the same time. The audit is asking whether the city's contract management system can be improved. Second, the contractor evaluation rubric assesses contractor performance. Third, the city's budget process determines how limited public...
Hang on one second. Did you sign up to speak independently? So we have a system for donating time, but you'll be given your 3 minutes now.
Starting?
Well,
excellent.
We're going to start, yes.
Thank you, Mayor.
You were supposed to donate your time in a different way, and we'll audit that later.
All right. Thank you, Mayor. Third, the city's budget process determines how limited public resources are allocated. And fourth, the policy decision to establish community priorities. These are 4 processes that are related but not interchangeable. They answer different questions. They rely on different information. As someone who has spent a career administering public contracts, I respectfully ask 3 government questions. If only a limited number of contracts were reviewed, what basis exists for applying those findings beyond the contracts examined? Did this review distinguish between a material failure to perform, a contract variance resulting from approved modifications, or operational realities? And third, if the auditor has stated this review was not intended to characterize the nonprofit sector as a whole, what safeguards will ensure these findings are not interpreted beyond their intended scope. This is not a criticism of the audit. These are government questions. Ultimately, this is not about nonprofits. It is about the tens and thousands of individuals that nonprofit serves in Austin, Texas. They represent children, they represent seniors, survivors, families. These are not simply nonprofit contracts. They are public investments. My request today is simple. Implement the recommendations that strengthen the city's contract management system, but also protect the integrity of this review by ensuring its findings are interpreted within the scope for which they were intended. Because accountability should always follow evidence. Thank you, Mayor.
Thank you. Appreciate you being here and what you do.
Good morning, Mayor, council members. My name is Liz Schoenfeld. I serve as the CEO of LifeWorks and also as a member of One Voice Central Texas. I want to begin by thanking the City Auditor for the work that went into this report and also thanking the Mayor and Councilmember Alter for sponsoring this audit because accountability matters. When public dollars are invested in services for our community, there should be clear expectations, strong oversight, and meaningful measures of performance. Nonprofits that consistently underperform or fail to deliver on their contractual obligations should not continue to be awarded city contracts. At the same time, I urge the committee to interpret this report with real care. The audit reviewed a small sample of contracts and explicitly notes that the results cannot be generalized to the broader portfolio of nonprofit contracts. Additionally, the report identifies concerns related to reporting delays, communication practices, and inconsistent contract management processes that are more a reflection of the city's own contracting system than the performance of any single nonprofit provider. These details matter, especially in the middle of a budget process where millions in social service contracts are already under consideration for elimination. Without the appropriate context, the public narrative can become overly simplistic that nonprofits fail to deliver. This risks causing unintended reputational harm to high-performing nonprofits at exactly the time when organizations are being asked to increase private fundraising and diversify revenue sources. Ultimately, accountability only works when it is complete. When performance expectations are not met, we should understand why. Were modifications approved? Were there external factors that affected participation or service delivery? Were residents ultimately served in the way the contract intended? Such questions help to distinguish between a reporting variance, a contract management issue, and a true failure to perform. As Council considers this report and broader budget decisions, I would encourage a careful evidence-based approach. We should absolutely strengthen accountability systems. We should also ensure that conclusions are proportional to the information available and that essential community services are evaluated on a contract-by-contract and agency-by-agency basis. Our most vulnerable residents deserve nothing less. Thank you.
Thank you.
Good morning, ladies and gentlemen, Mr. Mayor, council members, Jeffrey Bowen, District 8. Many of you may know I've been a longtime contract manager, construction manager, both profit and for nonprofit. Spent a lot of times in a nonprofit for the Air Force. So I appreciate the work being done through this audit. And as somebody that has read many of the past performance evaluations of the audits, those type of things, it constantly brings up to me the thought of where are the issues that are lacking. It constantly seems to be that maybe it's a training issue because we're not completing out final evaluations. We're not completing some of the paperwork as we see. And so it's these past reports that what are we actually learning from this process? I see the continuation of the same things. These ladies made some very great points in that how is this affecting not just the nonprofits, but the rest of us that don't see what are actually being maintained or what's being actually provided or the the evaluations of how well these programs work. So the lack of understanding seems to be one of the things that the public needs to understand and that the rest of us need to understand what's going on. And identifying the points in the programs that are actually working and actually failing. How do we fix those failures? How do we make those that are working work in other programs also? This should be a continuous process. As somebody that taught total quality management for a while, it was always about continuous process. It may be called something different now because management has a tendency to change the names of what the latest, greatest thing is. So, this needs to be a continuous process. It needs to be continuously reviewed, even by yourself, Mr. Mayor. You've noted that many, many times. But it does have effects on whether a program fails or succeeds, because the effects of how it on services, on our budgets that we're talking about right now, and we need to constantly be looking at these issues because it affects all of us, and it affects the way the city operates and the impacts on not only the programs but also on the taxpayers. Actually, I appreciate the extra time. I'm now trying to figure out what the hell to do with the extra 15 seconds, but yeah, I can figure that out.
You can always not talk.
Well, that's not going to happen. So again, I appreciate the work that the audit committee or the audit team has done, and they need to be thanked for that service. Thank you.
Thank you.
No, that's me. All right, good morning. My name is Mary McCowan. I work in permanent supportive housing and family elder care. Family elder care is a local nonprofit dedicated to helping low-income older adults and adults with disabilities remain safely housed and live with dignity. We provide housing and supportive services to individuals facing housing instability, food insecurity, physical, mental, and emotional health challenges. Unfortunately, older adults are facing increasing hardships. Compared to last year, more older adults are living in poverty, experiencing homelessness, and becoming victims of financial exploitation. At the same time, many eligible seniors are not receiving critical public benefits and are losing access to Medicaid. I see these challenges every day at work. Our mission is to help older adults remain independent, financially stable, and healthy. And that begins with a safe place to call home. Here in Central Texas, older adults are the fastest growing population experiencing homelessness. Between 2023 and 2025, homelessness among seniors increased by 70%. Why does that matter? Because preventing homelessness and keeping people housed costs far less than allowing someone to fall into homelessness and then trying to help them recover. At Family Elder Care, we provide affordable housing paired with wraparound services that work. We help older adults enroll in Medicare, Medicaid, Social Security, veterans benefits, disability programs. We offer financial stability services, protection from exploitation and scams, and support for social isolation and depression services that help people remain housed and reduce the need for more costly emergency interventions. We recognize the difficult budget decisions before the city and support thoughtful stewardship of public resources. We respectfully ask that you are mindful of the many variables that can affect a program's impact and recognize those that are completely outside of our control. Please protect the social services that demonstrate measurable outcomes, strengthen our communities, and ultimately save the city money. Thank you for your time.
Thank you. Thank all of you for being here. Thanks for what you do. Members, what I think, unless there's objection, what we'll do is we'll take up item number 1, which is the approval of the minutes. But because of the interest in this item, go to this item next, and then we'll go back up to the top of the agenda unless there's objection. So I'm also looking at the auditor to make sure that they're ready, since I'm going to take that out of order. That way, people that are interested in this that are here can be here for that. So with that, let's go to item number 1, which is the approval of the minutes for the May 20th, 2026 meeting. Let me ask if, well, before you, I'm going to ask you to, there's one suggested edit. I was going to ask if anybody has any edits. The suggested edit is on item number 11, where it says identify items to discuss at future meetings. It's unclear to me the way it's written. So for clarity purposes, I would suggest that we edit it to say, Mayor Watson asked if there were suggested items for future meetings, which I think is more clear. So with that, Councilmember Alter moves adoption of the minutes. It's seconded by the Mayor Pro Tem with that change that I've just read into the record. Is there any objection? Without objection, item number 1 is adopted. All right, members, then let's go to item number 7, which is a briefing on nonprofit contract performance management audit. And as we call the auditor and his folks up to talk about this, let me say a few things about this audit, in part because I've been behind it from the beginning, and this is actually a follow-up to a request I made last spring with regard to nonprofit and money. I want to be very clear about what this audit is and what it isn't. This report, as I've indicated, is the second phase of a special request that I and the Audit and Finance Committee made in the spring of last year to make sure we understood our investment to serve vulnerable residents and whether the public dollars we're spending is having the positive impact we intended and we want. It is not an attack on nonprofit organizations or any specific nonprofit. As has been pointed out just this morning, Austin relies on many dedicated nonprofits and their dedicated employees who do difficult, compassionate work for people facing some of the hardest moments of their lives. This is an audit of the city's system for purchasing, monitoring, and assuring the delivery of essential services. And let's be candid, the findings are troubling. It appears we're not effectively meeting the goals that we set. You'll hear, and we're told, that 19 of the 25 sampled contracts missed at least one performance expectation. Almost half of the performance expectations reviewed weren't met. In many instances, performance was substantially below what the contracts required. Those numbers don't just represent boxes that were left unchecked on a report. They likely represent vulnerable Austinites who didn't receive services the city agreed to purchase for them. And we need to understand why. Some expectations may have been badly written. Some contracts may have been inadequately funded. Providers may have faced staffing problems, increased demand, reduced donations, or other circumstances outside their control. If the city created unrealistic requirements or failed to manage those agreements properly, the city must take responsibility and correct those failures. But none of those possibilities supports a system in which expectations can be missed repeatedly without consistent review, without corrective action, or without consequences. Good fiscal stewardship and strong social services are not competing goals. Financial accountability isn't in conflict with personal compassion. In fact, caring for our most vulnerable requires us to care about these services and to care about whether they're delivered. The focus should not be on protecting City Hall or protecting any particular organization. It should be on protecting the people these dollars were meant to serve. We should have clear and realistic performance expectations. We should have transparent and equitable selection processes. We should give providers a fair opportunity to explain problems and correct them. And when performance doesn't improve, we should be willing to redirect public money so that the promised services are actually provided. Progressive government should be accountable government. We can't and shouldn't measure compassion by how much money we appropriate and spend. We should measure it by whether we're doing what's necessary to assure people receive the help the money was intended to provide. So I appreciate everybody's concern, those that have been here today, but I want to be very clear about what it is we're doing. We want to serve vulnerable Austinites, and the best way for us to do that is by way of an audit that gets us to results, and then we as a city follow up appropriately. And with that, I'll turn to our city auditor. Be sure you turn on that button.
Sorry about that.
Everybody wants to hear you.
Good morning, council members. My name is Henry Katumwa from the Office of the City Auditor. Thanks for giving us a chance this morning to talk about this very critical service. The objective of the audit was to determine whether the city is effectively and efficiently writing and managing non-profit contracts for family and social services. For this audit, we specifically focused on the city's policies, processes, and procedures for managing these contracts. Family and social service contracts can be broken up into two categories: general nonprofit contracts and grants. For this presentation, we are using the term contracts to refer to both these categories. Next slide. Family and social services are very critical to the city of Austin because they support vulnerable residents who are facing various challenges. On the other hand, they also help us as a community to make our community strong, safe, and resilient. These services cover a wide range of support, such as homelessness services, health and behavioral care, job training, services for children, youth, and families, and so on. During fiscal year 2025, the city spent about $100 million on these services. City departments manage these contracts, including Austin Public Health, Homelessness Strategies and Operations, Housing, Municipal Court, Economic Development, and a few others. These departments are required, among other things, to ensure that nonprofits meet all performance expectations. Next slide. The city has structures in place to manage these contracts. For example, in the contracts we reviewed, the performance expectations were specific, measurable, and time-bound, and this is very important. Secondly, departments have processes to manage contract information, including performance information that we get from the nonprofits. Also, city staff conduct compliance site visits to look at how nonprofits are using the funding, how they are performing, and how they are complying with contractual requirements. Next slide, please. We have one finding for this audit. We found that vulnerable residents may not be able to get expected services. While the city has a process for managing the contracts, it does not ensure that the nonprofits consistently provide agreed upon services. To support our conclusions, we reviewed performance expectations laid out in a sample of 25 contracts. Most contracts included a common set of performance expectations, as you can see on this slide, starting with unduplicated clients served. This is the primary indicator of how many unique people the program served. The next three expectations provide a direct measure of program effectiveness. These help the city determine whether nonprofits are delivering meaningful services. Next slide, please. We found that for about 3/4 of the 25 contracts, the nonprofits did not meet one or more of the performance expectations. It is important to clarify here that the sample we reviewed should not be subjected to the total population of the family of social service contracts. This is mainly due to the sample size of the contracts we reviewed. Next slide. We then looked deeper at the performance expectations within those contracts. We identified a significant number of instances where nonprofits did not meet agreed upon performance targets. As you can see on this slide, the nonprofits met 56 of the performance expectations. However, they did not meet 44 of them. Bearing in mind that these services support vulnerable people, this is a significant number of unmet expectations. We also found that the city does not have or enforce consequences that would motivate nonprofits to meet their performance goals. For the contracts we looked at, the city uses a cost reimbursement model. In this model, nonprofits are reimbursed for their expenses whether they meet the performance expectations or not. We further evaluated the performance expectations where the nonprofits did not meet the expected targets to understand the gaps, the deviations between what was expected and what the nonprofits provided. What we found is that for almost half of the unmet expectations, what was provided was more than 40% below the expected amount. For example, if a nonprofit was supposed to provide services for 100 unduplicated clients, but only provided services for 60 unduplicated clients, this would mean there was a gap or deviation of 40%. Slide. We also visited the nonprofits during this audit to look at supporting documentation for the performance measures they reported to the city. During the site visits, nonprofits shared some concerns about the city's contracting process, some of which are shown on this slide here. For example, they reported challenges with unrealistic performance expectations, struggles to find unduplicated clients, and inconsistent communication across city departments. We found that we as a city do not consistently evaluate the performance of our nonprofits once a contract ends. The departments do complete a contract closeout checklist. This mainly provides a basic status of a contract completion. It provides information such as, did the nonprofit deliver the services? Are there any pending issues or unresolved payments? A more robust review would, for example, among other things, assess the quality of the services provided, determine whether the services offered good value to the city, verify compliance with all contract terms, and assess how effectively nonprofits addressed instances of non-compliance. Staff in one department told us that they evaluate the performance of nonprofits at the end of each engagement. The chart on the right of this slide shows a performance closeout review for one of their contracts. The table on the right is the performance report associated with that review report. As you can see, the performance closeout report functions more like a checklist than a meaningful evaluation. For example, there is no assessment whether the services provided good value to the city. Also, the performance closeout review report states the nonprofit made satisfactory progress or met goals. When we compare the two reports on this slide without additional information, it does not appear that this is a meaningful assessment of the work of this nonprofit. To address the issues we noted in this audit, we issued two recommendations, which are shown on this slide. Management agreed with these recommendations. Full implementation timeline for the two recommendations will be sometime next year. Once again, thanks for giving us this time this morning to discuss this audit. This ends my presentation, and we'll be happy to answer any questions that you have.
Great, thank you. I guess I'll start with, let me ask a few questions. And by the way, if anybody has questions, let me know. I want to start with the findings and ask a few questions about that. Of the 25 sampled contracts, were 19 different providers involved, or did some providers hold multiple contracts?
Jason Hadavi, City Auditor. Across the 25 contracts, there were 20 nonprofit agencies. So a couple of them had more than one contract.
So some did have multiple contracts, and that's okay. And you said it, but I want to emphasize it. What percentage of all independent individual performance measure expectations were missed?
So it was 67 out of 151 expectations were below the expected amount, 44%.
All right. Were the missed measures primarily outputs, such as the number of people served, or were the outcomes that may have been out of the provider's full control?
It was a mixture. So of the 67 expectations that were not met, 52 were output expectations and 15 were outcome expectations.
Okay, so I'm sorry. Say that. I was trying to keep up with you, and I fell behind. Say that again.
There was 67 expectations that were not met,
Right.
and 52 of them were output.
I see. Okay. And in looking at those, did you find that the services? Did you find evidence that the services may have occurred, but they were poorly documented, or that the services just weren't delivered?
Well, we primarily evaluated what the nonprofits reported to the city department that held the contract. We did conduct 5 site visits with nonprofit entities to compare what was reported to their source records. And in all 5 of those cases, we found that what was reported mirrored their source records exactly. So we didn't have any concerns there. But the findings were primarily based on what the nonprofits reported to the city.
I see. Okay. There's been some question about the fairness to the providers in this, and we heard some of that this morning already. Were the providers given an opportunity to explain variances and respond to the findings?
I'm going to break this question up in a couple
Sure.
of different arenas. So
He audited my question.
it's what we do. So first, when agencies are reporting their data to the departments, depending on which department they're working with, they're reporting through different systems, through different mechanisms. Austin Public Health had the largest group of contracts in our sample, and they hold the majority of the contracts in this population. In their system, when there's a variance below 10%, they're not asked for an explanation. But if the variance is above 10%, the system allows them to provide justification for why they missed the expectation. And there was, I would say, inconsistent usage of that. There were times where reasoning was given, and there were times where we didn't see that information. In terms of responding to the audit, city management was our auditee, so that's who we asked for a management response per our audit process. We did collect information when we met with the nonprofits on those site visits, and we incorporated some of that feedback into the report, but not in the form of a response, just in the narrative of the report.
Okay. And I'm going to ask city management to respond here in a second, because I'm going to have some questions for them as well. So how many times were you all told by providers, or was there some evidence that the city had been told that the target in the agreement was unachievable?
I couldn't say a specific number. There were questions brought up about the goals, and I would say it was a mixture of when we were out at site visits and more prominently in the explanation of variances reported to the city. But I'd have to go back to our records to get back to you on that.
Is there a process set up, or were there opportunity to amend contracts if something came up that you just couldn't achieve the goals?
We didn't see that specifically in our sample. There's definitely the ability to amend contracts, and we've seen contracts amended in lots of different audits, investigations over the years. But I'd have to go back to the records to see if any of these goals were amended.
I'd like to know a little bit about that, and that leads to another question that may be the same answer, but was there some effort to determine whether contracts were adequately funded to achieve the stated expectations? In other words, did the city create an expectation and then somehow it wasn't funded appropriately?
I would say that was beyond the scope of our audit. So we're looking at, given the contracts and the amounts, whether they were amended or not, that were active during 2025, we looked at how those performance expectations were met or not met and what the city did in response to that.
Did this audit go into any external conditions that might be meaningful causes for underperformance? I'd
go back to the answer I provided about the variances.
Right.
So in the system, there were sometimes there were internal challenges cited, sometimes there were external challenges cited, and the same during our site visits. So changing environment in the city, in the country, the economic impact, whether or not clients were comfortable seeking out services came up. So there was a number of factors. Some of them were internal, some of them were external.
Okay. Ms. Rogers, are you going to provide the management response?
Good morning, sir. Carrie Rogers, Government Relations Officer for the City of Austin. Can you repeat the question?
Well, I don't have one yet.
Okay.
The question was, are you going to give the response? So.
Oh, yes, sir.
Okay.
I'm here for that.
Why don't you do that, and then I may have a few questions specifically.
Thank you, sir. And I also have with me James Scarborough, our Director of Austin Financial Services Procurement Division. On behalf of City Manager Broadnax, I first want to say thank you for the collaboration with the City Auditor's Office. And I think we would echo what you have said earlier, Mayor Watson, and what I think Mr. Hadavi has conveyed in his comments, is that the audit is about the process itself. And it is not about the nonprofit's performance in this particular audit. Management agrees with the findings of the audit, and I think has identified some opportunities for improvement in both the process, starting with the distinction between social services contracts and grants, which you'll see outlined in his response that I believe is on page 11 of the posted materials. A lot of the challenges that I think we've had and identified in this audit and in prior audits is related to the interpretation and the distinction of social services contracts and grants and the guidelines that govern those processes. The city manager recommends centralizing management of contracts within Austin Financial Services and the procurement division under Mr. Scarborough, and recommends centralizing city grants, and that's where the city is an auditor. I mean, the city is the grantor under Austin Government Relations, and so that consistent processes can be put in place. And this is for the benefit of the city, the taxpayer, but it also is a benefit to the vendors who may often have contracts with multiple departments doing the exact same work, but would have different performance expectations. And so this is meant to be a benefit to them as well. With that, I'm pleased to take any questions, and of course, I open up for correction for Mr. Scarborough or Mr. Hadavi.
And I think you may have answered this, but I want to highlight it because I think it is something that jumps out, and that is the distinction between a city grant and a purchase service contract. Define that, if you will.
Yes, sir. So a contract is fee for services, correct? The city makes the distinction of social services contracts which sends it down a different path here at the organization that is unlike any other municipality, especially large municipality here in Texas or across the country. But a contract is fee for services, where the city is contracting its services and gets a benefit back to the city. A grant is often structured reimbursement based, as is many of these social services contracts. So the vendor sends in an invoice and the city reimburses that invoice. I don't know if Mr. Scarborough wants to add anything regarding contracting, but I think here at the city, when those services are labeled as social services contracts, the path that it goes down exempts those contracts from our anti-lobbying ordinance, and it also exempts those contracts from competitive bidding. And so that's where I think some of our challenges come in, as outlined in both the audit and in the management response.
Okay. In the management response, it's indicated that there's a proposed implementation schedule that goes all the way until October of 2027. I mean, these are pretty serious findings. I really can't imagine we want us to wait until October 2027. That's 18 months. Is there a way to accelerate that?
Mayor, council members, James Scarborough, Financial Services. Absolutely. The message is absolutely received. To the extent that these are defined as contracts and they're under the authority of city manager and procurement staff, they will be executed with full complement of requirements that are subject to all city contracts. The differentiation has been, as Carrie pointed out, this specific category of contracts has been recognized differently because they function for the most part like grants, and they're written differently, they're competed differently, they're administered differently, and most of that, if not the vast majority of that, is done outside of city procurement. But going forward, we have established a much more clear definition of city contracts versus city grants, and we'll be applying a heightened level of management control over both categories of agreements going forward.
I think I would add to that the reason for the deadline, and of course we will do as mayor and city council suggest, is because there are several adjacent or overlapping efforts that are going on regarding procurement and these contracts, and so it was allowing time for that. The change in grants should be fairly simple because we have those standard operating procedures for cities, for grants that the city acquires, and so it's a matter of adding grants that the city would award.
Okay. The initiative that I brought forward and the council unanimously adopted to improve the contracts and grant management asked for it to have updated rules and procedures, enhanced compliance and enforcement rules, standardized documents for all solicitations and contract types, and of course this audit seems to be calling for that. Is that what you're answering when you say you gave the answer you just gave, that those are going to happen?
Yes, sir. The timeline contemplated in the management response is kind of a safeguard associated with the full implementation of the new system. However, the airplane is always in the air, so sure. we are regularly putting these contracts together on behalf of our customer departments. To the extent that these improvements in monitoring and administering these agreements can be implemented now, we'll be implementing them as we create these contracts going forward.
Good. It also, there was a recommendation, we've talked about it a little bit, and Ms. Rogers, you sort of mentioned it, is that the recommendation to management is that there be a single department, so you don't have this diffuse, but I'm hearing two things, and that goes back to the difference between grants and contracts, right? You're saying that for grants, it would be IGR, and I take it that you're saying for contracts, it would be through our more normal procurement process.
Yes, sir, that's correct. And management of the dollars of the scope of work would remain with the departments. It is that financial services would be on the front end of developing the solicitation for the contract and would do compliance on the back end so that you have that separation of duties. And then similarly for city grants, AGR would be on the front end working with the department to develop the NOFA for that grant. The department would manage the scope, and then AGR would be on the back end ensuring compliance.
Good. Okay. Let me just also say, I'm going to recognize the Mayor Pro Tem, but I want to say, for those that are watching and pay attention to this, this is what the audit process is supposed to do. Austin, the city of Austin is a very complex organization, and we follow a process. There have been a number of audits done. This is a multiple tiered process to get us to this today. But I just want the public to be aware, we do this on a routine basis in different areas, and it gets good headlines sometimes, and those headlines sometimes act like somebody has discovered something. Well, it's the city that discovered that. The city, through its audit process, has discovered something that needs to be fixed, and now we're in the process of fixing that. Mayor Pro Tem?
Thank you, Mayor. And I really want to start out by reiterating that again, maybe there would be political advantage to not doing audits and ignoring problems, but that's not good governance. I mean, we've got to continuously identify areas where there are issues. Again, not even where there are issues, but we always have to be reviewing for good practices, for best practices, making sure that we're being efficient and effective. And I mean, I think this is just a natural part of it. So again, to me, when the audits come out, that is good government. That is making sure that we're trying to be efficient and effective with these dollars. Something, again, they're not always going to come out well. There's going to come out, there's going to be findings, there's going to be concerns, but that's part of the process. And again, that's a good thing that we're doing this, not a bad thing. I mean, you were with the state. The state does something very, very similar, and they have some pretty damning audits of different departments, and that leads to changes, and that leads to improvements. This is a natural part of the process of good government. Though one area that I wanted to focus on was especially with nonprofit organizations, and I've been very engaged and involved with multiple nonprofit organizations in different capacities. Sometimes it's hard to pick numbers for the performance metrics. And I'll think about, there's two that I currently am very involved with. One would be the Sobering Center. You know, when we established the Sobering Center, that was a very pioneering type of effort where there was not a lot of good data out there about how much it was going to cost. We had really no idea how many clients were going to come in the door. You know, that, in other words, you set those initial expectations, and then you go out there and do the work, and then you go back and you see kind of how realistic were those initial set of expectations. And again, I think about also Cap Metro recently, they launched this pickup service, and they initially wanted, what the metric was, how many people are getting picked up within 15 minutes. And we were not really hitting that 15-minute metric very well, yet customer service, that the customers were reporting very high levels of customer service. And so in the kind of back and forth, it was like that 15-minute metric, we kind of arbitrarily picked that as a number and then realized that probably wasn't a good metric for kind of trying to grade our own system. So I guess the question around that would be how accurate, how established, how well known are the metrics? And I'm sorry, just to expand on a little bit more, an organization like a Meals on Wheels, someone that has been doing their work for years and years, they have good metrics. They know more or less how many folks they're going to serve this year. They know more or less how many folks. That's much easier to kind of identify a solid metric where we can kind of get a good sense of how they're doing. Other outreach, working with youth, those kinds of a little fuzzier, harder to identify. Where are we in terms of the accuracy and the effectiveness, the good design of the metrics that we're trying to capture with this audit and with the findings that they report back?
Well, I would say from an audit perspective, and management may look at it a little bit differently. It's tied to the recommendation. So we're looking for a lead department because it varies by department, and so depending on which department is involved, or holding the contract, the way those performance expectations are built into the contract, the way the contract is built, and how those expectations are set varies. And I know that at least in some of these, the nonprofit agency had discussions with management about what expectations they were going to set and what performance expectations should be built into the contract. How much back and forth would between management and the nonprofit agency? We'd have to look at each one individually. So there is a discussion, but how accurate we are, well, that yet to be determined.
Mayor Pro Tem, I would add this is part of management's response is to provide those consistent guidelines. What we have heard from our partners in the community is they may have contracts with multiple departments, and one department wants them to track how many phone calls they receive, and another department may want them to track how many people walked in the door. And so it's really a challenge for the nonprofit to be able to determine what is the metrics, the outcome that the city is really after. And so which I would see as the benefit of having those consistent guidelines for both contracts and grants that the city awards.
And just to follow up on that, do we have a sense, especially of the audited contracts, and the generally speaking, my sense would be that the older a contract is, the more established that it is, and you should have a better sense of what the expectations and the metrics and that, and the the newer the services are, that there you're still into there's a more gray area, there's more kind of unknowns within that. Do we have any sense of that from the audit?
I mean, I understand the perspective, but I would point out that we're constantly in a changing environment from a federal legislation perspective, from a state legislation perspective, from an economic climate perspective. So there's a lot of variables that are changing over time. And I think those variables have a major impact on whether those expectations can be met or not. So we might have set reasonable expectations when the contract was written based on the history, but then because of how much environmental factors are changing the nonprofit's ability to reach those clients, to reach those vulnerable residents, those expectations may not be as reachable.
And is there any sense of the scope too? Are we in terms of the audited contracts? My assumption, not an informed assumption, is that we're mostly talking about human services type, health and human services type contracts. Is that accurate? Or is that the bulk of the contracts?
You're talking about within our sample?
Let's talk about the sample, because we know that universe, right?
Yeah, I want to go back and review all 25 of them to be sure, but I would say you're not far off. That they are individual focused, yes, person focused.
All right. Thank you, Mayor.
Thank you, Mayor Pro Tem. Councilmember Duchin.
Thank you, Mayor. First of all, I want to say I appreciate the thoroughness of this work, and I also appreciate the sensitivity around it. I have a couple of questions regarding some of the conclusions or the findings. I know one issue that you identified in here that organizations are dealing with are things like staffing challenges and client concerns about disclosing information. Are there any other issues that came up in your conversations with the sample group that we ought to be more aware of in terms of the difficulties that the organizations themselves are addressing? I know earlier came up that there may be communication issues with the city or other things like that. What else came up that you guys can share with us?
I know that there were funding issues from other levels of government, so loss of funding from federal and state level that played a role. Mentioned the staffing challenges. I think the legislative environment has created, depending on which contract we're talking about, an environment where the target residents, the clients that they're looking to serve, may not feel comfortable seeking out those services, and so that was a challenge also. But it varied from contract to contract because the type of services that were provided varied so significantly.
Got it. Thank you for that. I'm also curious about the conclusion, the staff response, which talked about, let me pull it up here. It talked about sightline, I think was the language that it used, that bringing it within financial services would give the city more, again, sightline for this. Can you expand on that conclusion, what that means?
Yes, sir, council member, and I welcome Mr. Scarborough to jump in and correct me. Currently, most of these contracts are solicited, procured, executed, managed, and compliance done entirely within a department. And by specifically these recommendations coming to the city manager's office instead of one specific department, but also in the implementation of the recommendations, by putting them in one of our service departments, such as the procurement division, it will give them greater knowledge and sightline across the entire organization of what the needs are. Specifically, I give the example of eviction assistance, that we may have one department who's wanting to go out and solicit eviction assistance services, but procurement might know another department wants to do the same thing. And so then they can work on that solicitation and procurement together.
Anything you want to add, Mr. Scarborough?
Councilmember, that's accurate. We have visibility over thousands of city contracts, and at any given time, we can see all the ones that are actively sourcing, the ones that are in administration, and the ones that have actions that are coming up soon, where we have to either extend, or we have to terminate, or we have to take some sort of action on the contract. That kind of visibility does not occur when the contract is sourced and it's administered outside of our system and our purview. We do have indirect access to them, but it's not in a system perspective, so it's not possible for us to report on it. And when you can report on data, you can develop strategy around it and start to implement plans to address city objectives with that strategy.
Thank you for that. I'm also curious if, in terms of arriving at that particular solution, did we look at how other cities that are perhaps well known for managing contracts and dealing with some of the problems that Mr. Hadavi just mentioned in terms of reporting or funding or other issues that the vendors themselves are struggling with? Do we look at anybody that we know of that does a really good job? Is that the way they solved it, was by sort of centralizing it in financial services, or is this kind of our conclusion based on how we've been approaching the problem ourselves?
I would say that we didn't look at that specifically within this project, but we've done a lot of audits, as city management can attest to, and so in line with how we've identified other findings and other ways, it's the centralized approach, given how many different departments were involved in these contracts. We had 25 contracts in our sample. That was 8 different departments, and we saw such variation. We saw the need for some kind of standardization, and that's why we arrived at a lead department focus.
Council member, myself and my colleagues in central procurement, we regularly correspond with our colleagues in the other Texas local governments, state, and other leading organizations across the country, looking for best practices, standards, and new techniques to develop better sourcing and contract opportunities. We see that these types of organizations are established differently for a variety of reasons. Some of them are operational. Some of them are just based on the political and organizational preferences of the management of those governments. So we don't see a lot of specific trend in the type of organization and how their procurement activities are conducted. We feel that as the city's procurement operations have evolved, that we're in the ideal organizational structure currently, and we have a good plan for evolving it based on the desire for more management control in this area.
Got it. Thank you. And I would assume that Ms. Rogers has been instrumental in making sure that we are staying abreast of kind of what other organizations and cities are doing, counties, in this space. Last question I've got is this goal of sort of centralizing and having this sightline within financial services. Is that in part to help protect us from what could be kind of unintended consequences from having this sort of review, then seeing contracts or organizations work on like recalibrating their goals and expectations based on the findings so that they're sort of setting themselves up for success relative to the findings from today?
Councilmember, it would be the intention of Austin Financial Services and Central Procurement to still endeavor to meet the needs of the customer departments and their service population. It would not be our intention to fundamentally change the agreements, but just to source them more transparently and to make the contract work better. To the extent that these are actually grant agreements, to also make sure that they're established in a competitive manner and that they function as well as grants should function. But to the extent that they are submitted to us as contracts, they will be held to the standard that we apply to all contracts and to make them function as well as possible, but while respecting the needs of the customer department and ensuring that they're as effective as possible with their target community.
Thank you. Thank you, Mayor.
Thank you, Councilmember. Councilmember Alter.
Thank you very much. A lot of my questions have been asked, but I wanted to take a step back for a moment and kind of understand the landscape of why we even have these contracts. And so I don't know if this is an appropriate question for you, Ms. Rogers, or ACM Hayden Howard, but why do we partner with nonprofits? Why doesn't the city just do this work itself?
Good morning, Stephanie Hayden Howard, Assistant City Manager. That's actually a good question. And my thought is that the City of Austin, from a policy perspective, back in the 80s, thought about how can we reach populations where we may not have as many barriers, where people will trust the service provider and be able to do things quickly and more nimbly than the city government. And so the thought is that they started with a few nonprofits and established relationships, especially when I think about Integral Care has had a contract with us for probably over 30 years, but because that's their specialty. And that is not the City of Austin's specialty. So when you start to think about the specific service delivery, and we don't have that expertise on staff, we typically look for a partner that is able to provide those services. I think the other thing to also think about is that over the years, we are in a contracted relationship, but we also know that contracts are an extension of the services that the city were to provide because they are contracted services. And so we see this as a partnership arrangement as well. Lastly, we have looked into some services, that we could provide and bring them in-house. And to be transparent, it would cost the city more to provide the services if we brought those in-house. So those are the things over the years that I have come to find out of why the city works with nonprofit organizations.
So to distill all that down, basically it's, generally speaking, more effective in reaching the audiences that we're trying to reach, and more cost-effective to do so. And when we think about what these contracts are doing, like actual service provision, a lot of these contracts save us dollars from somewhere else, right? So we've had a lot of conversations here around homelessness contracts, but public health as well. Can you talk a little bit about why we're even doing some of this work? What's the benefit to the average citizen who may not need some of these services?
We always think about cost avoidance, and we also think about return on investment. And so when we are thinking about, if we have a person that is stably housed, they're not contacting police, they're not contacting the emergency services. And so they're stably housed, and so the odds of them living a longer, healthier life are going to be greater. So we do think about those things. But when we think about return on investment, we think about if we spend $1 in an area of prevention, especially early childhood outcomes, being able to educate a child early in life, and then you put them on a different type of trajectory. And so those are the things that we really think about. So when you start to look at the outcome measures that the departments have, they've looked at those outcome measures and have looked for specific outcomes that would either progress them to the next grade, remain mentally stable, stay housed in their homes. And so all of that makes us a healthier society.
Yeah. Well, the reason I wanted to kind of just take that step back is because, as you noted, like, we are relying on a number of partners. I mean, we talked about 25 contracts here. The number is upwards, I think, of 200 of these in the latest list I've seen, and many of them are doing incredible work. I mean, we got communications from the food bank talking about how many meals they're providing to residents, whether they're students or senior citizens or low-income communities, individuals who, without that assistance, we would see those costs show up elsewhere. And it's just the right thing to do. In a community like this, we should not have people going hungry every single day. And so I want to echo kind of where the mayor started. This is first and foremost about the people we're trying to serve. But it is a really an indictment of our ability to manage that service, not to paint a broad brush and say that every one of our partners is doing a bad job. I spoke last week, and I believe it firmly. We do have some contracts that are underperforming. Clearly, we see some of them documented here. And when we are trying to decide who is worthy of funding and who is not, I think we need to start that conversation with those who are not meeting the expectations. But we also, as has been highlighted, there are reasons why. Sometimes we set the expectations to an unrealistic number that Mayor Pro Tem was talking about. We would hate for this process to result in sandbagging any future contracts so that everyone always meets all their results, and we're not shooting for a higher level of success. So I'm going to be interested to see how we come up with that balance, because we don't want to put that perverse incentive into this structure. But I do think it's really important that we hone in on which of these contracts, and it may be a single contract, not the particular vendor. We might have someone who has 5 contracts and 4 of them are going stellar and 1 of them isn't. That doesn't mean that entity is doing a bad job. It means that we need to really focus in on that one contract and figure out what's the problem. And we are trying to serve people. I do have a couple questions for the auditor, just kind of technical questions to better understand. But I thank you, ACM Hayden Howard, for that context. When you chose the sample number, or the 25 contracts, how was that determined, just in terms of Is that a representative sample? Is that just what you had time to look at? Like, where? Help me understand where 25 fits into the broader regime.
Sure. So we knew that the sample size that would be needed to extrapolate to the population was much larger, and that was not our goal. That was not our focus. So we never really strive to that. We needed a representative sample to look at the city's process. So it wasn't just the number of contracts. It was also reflective of the different departments that had the contracts. And so we factored that in as well. So we needed to pick a large enough sample size to get a consistent approach of what the city was doing to manage these contracts.
Okay. And say that back to you just to make sure I'm understanding. You said large enough so that we can make sure that we know what's happening from our side of the equation, but not large enough that we could draw a conclusion about all of these types of contracts that we have.
Correct. I'm regretting a decision I made about 10 years ago when I convinced the prior city auditor to move our methodology to the back of the report. I said nobody ever pays attention to the methodology. And if someone goes all the way to the end of the report, they'll see our methodology, and we talk about the sample that we selected, and we we say that the conclusions cannot be subjected to the entire population. So this is the one and only time that someone should read the methodology for one of our reports.
My other question for you in terms of that methodology is just the time period in which you were looking at these contracts. Were you looking at contracts that were active for that contract year, or were you looking at contracts that had closed out for fiscal year 25?
Henry, correct me if I'm wrong, but the contract had to be active during some point in fiscal year 2025.
But we looked at the 4 quarters, actually, because usually there are 4 quarters before they sign another one. So we looked at the 4 quarters, but at least it must have been active during 2025.
Okay. I just want to make sure that we accounted for what you mentioned in the audit, that sometimes you see this backloading. And so if you were looking at a contract, let's say in Q2, that might end up showing more of their performance in Q4, that wasn't held against them just because of when that was looked at.
Definitely not. No, we looked at it quarterly.
All right. Well, I appreciate the work. I'm sure we'll continue the conversations. Thank you very much.
Councilmember Lane?
I want to thank the public commenters for the very important information that you brought forward in your public comment. My colleagues for the thorough and very helpful questions that have been asked, and as always, our auditor and Ms. Rogers for their extremely effective and necessary work. And I am not going to add any more questions, but I did at least want to say that. Thank you all for elevating the information that I was looking for.
Great. Thank you, Councilmember. All right, I think that does it. I do want to kind of try to summarize where we are because this has received so much attention. And again, I want to be clear about what certainly my position is, and I think I'm picking up from the other members of the committee, their position is as well, is that no one's trying to punish nonprofits when they miss a number. The position is that the city has a duty to design fair contracts, fund them responsibly, monitor them intelligently, and then make sure that vulnerable residents receive the services that the taxpayers are paying for. And that responsibility falls on the whole system, the city and the providers. And all of us need to remain firm about the results that we obtain. One of the things that we have talked about, I talk about it frequently, and the council has adopted a number of provisions during this year related to what I've been referring to as an efficiency, effectiveness, and innovation agenda. And in that context, efficiency, or the question we ought to ask is, are public dollars purchasing the agreed services? Pretty simple. Effectiveness, are vulnerable residents actually receiving meaningful help? And then innovation is, can the city improve its contracting, its monitoring, provider support, and accountability systems? I'll say it slightly different than I said at the beginning of this. Progressive government shouldn't merely spend money for compassionate purposes. It should make sure compassion produces results. And in fact, as I said earlier, caring deeply about these services requires us to care deeply about whether they're delivered to the people that we say we want served. So we love the institutions, we love our nonprofits in this city, but we need to make sure that we're also, as a government, focusing our love on the people they serve and making sure that those services are actually provided. So I want to also echo the thanks to everybody on this. I agree that with Councilmember Alter that there's still work to be done, and we'll be back on this. So thank you all very much.